guys, welcome back. You're listening to the Anxious Health Podcast. I'm so stoked today because I have somebody that we're going to have a conversation with today that I've been following for a long time. Y'all know I get super passionate about people that help me in my own health journey. And those are the people that I want to have on the podcast because I feel that their area of expertise is going to support you just as much as it is myself. And so I'm just thrilled to have Dr. Amie Hornaman. She is the thyroid woman. Like she knows the thyroid. She knows everything related to hormone optimization that's connected to your thyroid better than anybody else. In fact, she has a supplement line that we're going to talk about called Thyroid. I use Thyroid Fixer. So that's one of the supplements, but we're going to talk about her whole Fixxr supplement line. And beyond that, she just knows how we're treating the thyroid today versus what it is that the thyroid is actually supposed to do to be healthy. Like there's a huge gap in how we're treating thyroid related conditions and really the design of the thyroid and the breakdown that we're seeing in the thyroid. So Dr. Amie, thank you so much for joining us today. I'm so excited to have you on.
Oh, Courtney. Well, thank you for that amazing intro. Thanks for using Thyroid Fixer. And I'm super excited to be here.
Awesome. Okay. So tell us, because you have such extensive, really just knowledge of the thyroid. I think that your story is pretty powerful because you were in the field of exercise and body optimization and everything. And so you kind of lived through some of the problems with how the thyroid, especially for women, because we have a lot of women that are working out, they're doing all the right things, they're eating the right foods, and yet they're not seeing their metabolic health get better. So maybe just take us on a journey just of where you've been, because I think your story is pretty significant in the work that you do today.
Well, thank you. Yeah, most of us are here really from a pain to purpose story. We've gone through something and then that leads us to want to help others not go through the same thing that we went through. So my story started 20 some odd years ago and I was competing in figure competitions. So for those of you who don't know what that is, you are eating a very strict, very clean diet, hitting the gym sometimes twice a day, and you are stepping on stage in a bikini, which actually sounds crazy when I say it out loud, stepping on stage in a bikini to present your most athletic but yet lean self. And you're being judged essentially. So you really have to kind of bust your butt to lose that body fat because you want all your muscles to pop and the striations, and not in a masculine way. I don't want anyone to think like bodybuilding, like where women start looking like men, but a very feminine but yet athletic look. And I had done plenty of these shows, tons of photo shoots. I used to fitness model as well. And I knew how to get my body into that shape. Now I had a coach too, because I think it helps us to all have a coach to guide us. But I knew how my body was supposed to respond. So this one particular show I was getting ready for, it was a large show, the NPC Pittsburgh. And I was getting ready for it, doing all the things, the chicken, the asparagus, the broccoli, gym twice a day. And I would step on the scale to report in to my coach. Okay, what's your weight this week? And I would get on the scale and first week it's up 5 pounds. I'm like, wait a minute, this doesn't make sense. Biologically, it doesn't make sense. Maybe I'm holding some water weight. That's okay. I'll keep plugging away. Get on the scale again. Now it's up 10 pounds. Next week it's 15 pounds. I was literally putting on 5 pounds a week. I stopped weighing myself when I got to 25 pounds. I'm pretty sure I put on around 40. But I became so depressed and discouraged and really kind of shamed. I mean, I was embarrassed to report to my coach. I knew, or I thought, at least in my mind, oh, he's going to blame me. He's going to think I'm eating donuts and I'm not getting my workouts in and I'm just going off the rails. So I did what we all do. I went to my doctor because I'm like, my body is literally rebelling against me. What is going on? So I went to my doctor and I said, here's what I'm eating. Here's how I'm exercising. I handed him the paper of my diet and he looks at it. He runs a couple tests, comes back. You're normal. Everything's fine. So I left there. I'm like, yeah, okay. I don't feel normal. So I'm going to get a second opinion. I go to doctor number 2. That doctor tells me to eat less and exercise more. I kid you not. And at that point, it was impossible. I couldn't eat any less than what I was already eating without literally going into starvation. And I couldn't exercise anymore. My body was going to shut down. I was exhausted all the time. I was losing my hair. The weight kept going up. And I went to a total of, hold on to your hats, 6 doctors. Now, some of you might have already gone to like 10 or 20, and I applaud you for trying and keeping that hope alive. I went to 6 of them misdiagnosed me. You're normal. Everything's fine. One of them told me it's all in your head. And this is where we actually get the term medical gaslighting, people, because you literally start to think that you're crazy. You start to blame yourself. You start to think that it's you, that you're not doing enough. Finally, the 7th doctor touched my throat and said, swallow. And she says, you have a goiter, you have hypothyroidism. We're going to do an ultrasound. We're going to check it out. We're going to confirm it. But here you go. Here's a pill. So I left her. I mean, I was pumped up. I left her office. I'm like, oh my God, I finally have an answer. I have a name for what's going on with me. And I have a pill that's going to fix me. Then I gave it 5 months and I did not lose a single pound. I didn't feel better. I didn't gain energy. Not a hair grew back on my head. So I started doing research. This is what we do, right? We go to Dr. Google. Sometimes Dr. Google is good. Sometimes it's bad. So this time I found out through Dr. Google that there's this other thyroid hormone called T3. Now I was on T4. She gave me Synthroid. I knew nothing about it at the time. I took it because I thought it was going to be the answer to my prayers. So I start researching and I find, there's these other thyroid hormones. There's T1, there's T2, there's T3. Why am I only taking one thyroid hormone here? Oh, and it turns out that T4 pill that she gave me, it's inactive. It has to convert and become T3 in order to even give me a chance at burning this extra fat, in order to give me any kind of energy whatsoever. So I go back to her and I say, hey, there's these other thyroid hormones that seem pretty cool to me. Could we maybe add these in and try it out? She goes, I don't do that. I said, I'm going to find somebody who can then, because I think this is the path that I need to be on. So again, more research, more time goes by. So frustrating. A couple more pounds come on the scale, of course, but I kept hearing the name of this functional integrative practitioner. And God, the universe, whatever you believe in, we get signs. And if you don't listen to those signs, you're crazy, because that's a direction to go. So I listened, thank God. He gave me my life back. He did all the testing that I hadn't gotten done before with conventional medicine. He did a totally different thyroid treatment protocol. He sat with me and listened to me for 90 minutes. Whereas when I would go into the endocrinologist's office, I would get 7 minutes, maybe. And he literally changed my entire life, became my mentor. And that's why I changed careers, because that hell that I went through, I thought there's no way. I was in my 20s. How many other people are going through the same thing? Oh, and then they're stopping at doctor number 3 or 4 or 5, because after that many 5th opinions, 2nd opinions, 3rd opinions, you think, okay, well, they must be right. I mean, I've heard this same thing 5 different times, 6 different times, but you can't stop. You have to keep going. And that's why I'm in this space now, helping people the way that they should be helped, and not the way that I was treated in those first 7 doctors. Yeah.
Oh my gosh. That's so relatable. Just your story, because I see women all the time, exact same thing. They're getting, hey, you're fine. You're normal. And they're like, weight gain is normal. Cutting my calories down to 1,200, 1,400, whatever it is, and then exercising all day and me gaining weight is normal. Make it make sense, Right. But you mentioned something. You went to this doctor that changed your life and he did the appropriate testing. What other testing did he do? Because I know that a lot of these endocrinologists, they're running TSH and T4. And that's pretty much it. So what are the other relevant lab markers that need to be run, like the ones that were run on you that revealed the bigger problem?
Mm-hmm. And these are the ones that you have to get done every single time. And it's worth saying too, don't go into your doctor and say, can I have a thyroid panel or a full thyroid panel? Because just like Courtney just said, you're going to get TSH and free T4, and that is it. And that tells us nothing. We absolutely have to test free T3, which is the active thyroid hormone. So I said earlier, I got that pill. It was T4. It's inactive. We want to test how much of that T4 that you're either taking or that your thyroid gland is producing is being properly converted over into the active form T3. T3 is what gets to your cells. It's like a lock and key. So every single cell in your body has a receptor site on it for T3. So that T3 has to get in and turn that key. And that's what gives you a metabolism and energy and brain function and lets you poop every day and lets you grow your hair. All of those processes of the body, all systems, all organs are dependent on T3. So naturally, we want to test how much of that active thyroid hormone do you have in your body? And then next up, we want to test reverse T3 because that is the anti-thyroid hormone. That is the bouncer at the club. I actually just talked to a patient this morning, and his story was he actually was diagnosed hypothyroid at the age of 17, had thyroid cancer, had his thyroid removed, and was put on 300 micrograms of T4. And he was telling me how horribly he felt. No one was testing his reverse T3. And I said, your body most likely went into survival mode because they were pumping so much T4 into you, no T3 whatsoever. And all that T4 got converted over to reverse T3, the bouncer that sits outside your cell and tells T3 it can't get in to do its job. So it's literally blocking that active thyroid hormone from getting to the cell to turn the key to give you everything that you need to live. We have to test it. We want to test it. I want to know if you're in survival mode and your body's shutting down. And then I want to test TPO and TGA antibodies. That tells us if you have Hashimoto's. We want to know. And I mean, listen, 9 times out of 10, hypothyroid cases, if you are hypo, it's going to be Hashimoto's. It's going to be the autoimmune form where your body is attacking your thyroid gland because it thinks it's a bad guy, but it's worth knowing because then we can really crack down and say, okay, maybe we use some black cumin seed oil to lower the antibodies. Maybe, well, we definitely make you go gluten-free because we know that that will spur on an autoimmune attack. So the treatment isn't drastically different from hypothyroid to Hashimoto's, the autoimmune form, but it just gives us more information and we want to know.
Yep. That reverse T3 is a really interesting marker because a lot of times we can start to see stress patterns, just like you said, like when the body's putting the brakes on, it's a checks and balances. It's not a bad thing. It's just that the body wants you to slow down and it's going to force that slowdown. And that's where the weight gain, everybody gets frustrated. And then they actually stress their bodies more because they think, oh gosh, I'm gaining weight, so I just need to work out harder. Well, that's additional stress. Then you're restricting more calories, again, more stress. So it's just insult to injury. And you get on this cycle. And it will make people mad because it's just like, they feel like I'm trying so hard and I can't even manage. I can't even keep things the way that they are. And I'm not even happy with that. I'm just trying to keep the train from flying off the track. So It is really interesting how we don't measure that marker where that to me is like a huge red flag that we need to address something that's more systemic. The body is fighting something and it's sensing that we're not safe. We can't get out of parasympathetic. We need to shut it. We need to slow down because the body doesn't have the capacity to rebuild at the speed of breakdown. And that is a pattern that I see across the board all the time. So it's so cool that you just mentioned that. Talk to me about T2 because you're the only person that I have heard publicly speaking about T2 and like through your supplement line. This is actually what really turned me on to your message because I've learned a lot about this and I thought nobody else is talking about this. This girl knows what she's talking about. This woman's got it down. So explain T2 because for somebody that has a thyroid condition, which many women, especially like you said, have that autoimmune form of Hashimoto's, they're probably getting zero education on T2 from their endocrinologist or their provider.
Mm-hmm, absolutely. I've been studying T2, which the long name of it is 3,5-diodo-L-thymine. For any of you nerds out there that want to write that down, we're going to simplify and just call it T2. I've been studying that for, at least 15, 16 years now. And it started back when I'm still in practice, but I was working with individuals that so many of them were on T4 only, just like I was. And it wasn't working and they couldn't lose the weight. They were doing all the things. They weren't feeling better and their doctors were not listening to them whatsoever, giving them any T3. They would shut them down the same way as I was shut down by the endocrinologist. So T2, when you really start looking at it, it is an active thyroid hormone that is present. I mean, it's made by our thyroid gland. It's present in the natural desiccated thyroid medications like Armor or NP thyroid now are the two that are out. Nature thyroid kind of went by the wayside, but it is present in small quantities in those natural desiccated thyroid medications, but it's a powerful thyroid hormone. And lucky for us, it is available over the counter. Thank God, right? The FDA hasn't grabbed hold of it, or Big Pharma hasn't grabbed hold of it yet and put it into a pharmaceutical where you have to beg and plead with your doctor to please write me a script so I can feel better. You can actually get this over the counter. So that's a bonus for all of us. It acts at the mitochondrial level. So what T2 is doing is it's actually turning on that mitochondria so you can produce more ATP. Now, what that means for you is more energy. And it's not a caffeinated, jacked up energy like a fat burner from the old days where you would feel like you're crawling out of your skin and having a heart attack. It's a really nice, steady mitochondrial energy that just lets you float through the day and feel good. The other thing that it does, and this is documented in studies, when I've been saying I've been studying it, I've been using it with my patients, and I've been diving into the research. Now, there's very little human trials on it. There's a lot of mouse trials, very little human trials, but the human trials that we have are really strong and they're really interesting. So when we use T2 in humans, in 28 days, we saw an average of 4% body fat loss. Now that's not 4 pounds, that's 4%. The average pound loss was 9 pounds in about a month using T2. And because it's working to increase your basal metabolic rate. So the amount of fat that you're burning at rest, it's actually increasing your metabolism while you do nothing. You don't have to go exercise. I mean, it's always good to go exercise. It's always, you want to eat right as well, but it's literally increasing your metabolism. The other thing that it's doing is it's stimulating brown adipose tissue, BAT, which that's why we go into cold plunges, right? To stimulate that brown adipose tissue. We don't want the white fat. The white fat is the squishy fat. It's the fat that clogs our organs. It's the stuff that you grab and you go, I really want to lose this. The brown fat is active. It has a ton of mitochondria in it, which again, we're coming back to the mitochondria because T2 is going to stimulate the mitochondria. It's going to stimulate all that mitochondria and the brown adipose tissue and turn it on so that, number one, we get improved insulin sensitivity. So our insulin response is better. We get, again, that increased metabolism, and then we get the burning of the white fat without having to jump into a cold plunge. Although you can still do that. You can top it off and do them both. But it's so powerful. And here's the other thing. It does not act on the cardiovascular system. It does not act on the thyroid. So just quick little story, kind of going back to my bodybuilding days. Bodybuilders really were the OGs of biohacking. They were, I mean, listen, anybody in this industry, anybody that's competed, we've tried peptides before all y'all did. We were doing biohacking long before all y'all were, but this is what we do. We experimented on ourselves, good or bad. So back in the day when I was competing, many of the coaches would give women T3, whether they had a thyroid problem or not, because T3 will burn your body fat. Now, it will also burn muscle. And if given inappropriately to someone that doesn't really need it and you're just abusing it to lose body fat, you're going to shut down your own thyroid production and you're going to make yourself hypothyroid to where now you're going to need medication the rest of your life. So back in the day, I mean, people were doing that. And I would see girls come out the other side of a show and now they're gaining 40, 50 pounds and now they have to be on thyroid medication the rest of their life. And oh, by the way, they also lost some of that really precious muscle that they worked so hard to put on for the show. The beauty of T2, and I saw a trainer to the pros, the bodybuilder pros and figure pros. I saw him interviewed once and he said, he's like, I don't let my women use T3 because of everything I just said. He goes, I use T2 because it's only going to burn muscle or only going to burn fat. It is not going to burn muscle, which is what we want when we work so hard to put on the muscle. We want to keep it. So it's only going to burn fat and it's not going to have a thyroid effect, meaning it's not going to shut down your own thyroid function. So for any of you who you don't have a thyroid problem, guess what? You can use T2 to increase your basal metabolic rate, improve your energy, improve mitochondria function, won't shut down your thyroid, and it won't jack you up. You won't feel like like your heart's pounding out of your chest, or you're having heart palpitations, or your heart rate's increasing, you're having a heart attack. It won't do that. It has no cardiovascular effect too. So it's very, very safe for the entire population to use. Now, yes, I called it Thyroid Fixer because it was my baby. I've been wanting to birth this product for years now. And since I am the Thyroid Fixer, I named it after me, after the brand, right? But looking back, now I get questions like, can I use it if I don't have a thyroid problem? I say, yes, you can, because it doesn't have a thyroid effect. It won't jack up your thyroid or make you look like you have a thyroid problem or require you to be on thyroid medication after you use it and, let's say, reach your goal weight. So maybe I should have named it something else, but T2's in Thyroid Fixer, and we're seeing massive results because of everything I just said.
Yeah, I use your product, like I said earlier, and I really like it. I don't notice any of that, like no jitteriness. Like I honestly, I take it usually Monday through Friday because those are the days that I'm working out. There's just more demand physically, mentally on my body. And then I usually take like weekends off, but I do that with a lot of supplements just to give my body some breaks, like, and even with peptides, like just cycling on and off things. But I will tell you, I mean, this is probably the 4th month that I've been using it, and I'm the leanest I've ever been. Like, nice. I mean, and it's like very muscle sparing. So like you said, you know, with T3, you can really rev the engine too hard and start catabolizing and breaking down that precious muscle. And that you don't want to be catabolic and break down muscle. And so I personally believe in that. And that's one reason I'm just like, so passionate about being able to teach other women about this, because I see them really struggling with thyroid health. What are the other lifestyle factors that you felt like for you needed to be addressed in order to support the healing of your thyroid and thyroid optimization? Because I know that it's a lot bigger sometimes than just, you know, having enough hormone or converting it, but like supporting the outside, the externals that influence that. People have a lot of control. Are there foods people should stay away from? Are there lifestyle factors that should be considered? What else did you do to ultimately heal your thyroid? Because I would love to know how you even took your own health and were able to figure out, okay, this is the path. This is how, and you know, the proof is in the pudding. So, you know, I figured this would be a great place to start.
Absolutely. So first we'll start with lifestyle. I knew that the competition lifestyle of essentially over exercising and under eating wasn't exactly the best thing for my adrenals, wasn't exactly the best thing for my overall metabolism. It's a huge stressor. I mean, even though it's a challenge and we all do, you know, different challenges and sports, whatever, we love type A's love the competition. But we have to step back and say, is this good for me long term? So I actually switched from figure competitions / bodybuilding to powerlifting, because that didn't require me to diet down to nothing and to put my body through that stress. Yes, I was lifting heavy weights, but it was just fun. I became stronger instead of depleted and fatigued. So really addressing what are the stressors that are coming into your life, because with Hashimoto's, we know that a stressor is usually present to flip that switch. That's why we'll hear, oh, it was after my first child, my second child, after I moved, after I changed jobs, after a divorce, after a stressor is usually when symptoms start to appear. And that's because that autoimmune switch gets flipped into the on position. So I am pretty darn positive that my competition lifestyle at the time is what flipped that switch to the on position for me. So I knew I had to change that up. And then I had to do things to support my body. So number one, iodine. Iodine is so vital for the thyroid. It's vital for converting that T4 to T3, for bringing down the reverse T3. The main cause of thyroid nodules, low iodine function. One of the big triggers of increased reverse T3, low iodine function. And iodine also supports the immune system. So I'm a huge fan of using just a low dose. We don't have to go crazy. I know iodine gets a bad rep sometimes because Certain practitioners will recommend large amounts and send someone into a hyper state. But if we just use just enough for support, I think that is perfect. We use things like magnesium and vitamin D, keeping your immune system, keeping your body shored up. We want to look at, or I looked at, what are my hormones doing? Well, it turned out at the same time that I had hypothyroidism, I had polycystic ovarian syndrome too. So we needed to then move over here and address, oh, look, you're estrogen dominant, you're progesterone deficient. Let's address those things. So it's about looking at the whole picture, eating clean, going gluten-free, getting sleep, reducing stress, and supporting the body so that it can heal. Even if we are using thyroid hormone replacement or we're using T2, that's just providing hormones that your body's no longer making properly. Those hormones are not, just like you said, Courtney, they're not going to do everything. If you're a disaster over here, you're going to bed at 1:00 in the morning, you're throwing down some McDonald's, you get in a workout once a week. Okay, the thyroid hormone, not going to work, but you do everything together. Now you get rewarded for your efforts. Now you really start to see your body come back to life, your brain come back to life. You start to live the life that you're supposed to.
Yeah, that's great. I like the comment on iodine because, like you said, this can be somewhat controversial. You'll hear some people say, well, if you've got the autoimmune form of a thyroid deficiency or basically Hashimoto's, right? You've got the thyroid gland is under siege by the immune system, then you shouldn't take iodine. Do you see that there are any people that should absolutely not take iodine? I do take iodine, and I feel like that changed the game. I couldn't figure out why, after trying so many other things, why I could not optimize my thyroid. I was supporting my liver. I was like all these things, and iodine were the only thing that shifted it for me. So, I love this argument because there are some people that are just like so terrified of bringing iodine into the picture. And I think it's a much bigger miss than what we're giving it credit for. So give us an idea of where iodine falls, who maybe shouldn't consider iodine if you think that there is a candidate that falls in that bucket, and how you can use it and see it therapeutically help heal thyroid related conditions.
Quite honestly, I don't know if there's anyone that shouldn't use it. I mean, short of being in a full-blown hyper thyroid / Graves' disease thyroid storm, maybe in that case we don't. But when we look at what does iodine do? Number one, it detoxifies the body. So we have the halides. We have the very, very toxic halides, especially toxic to the thyroid: chlorine, bromide, and fluoride. Now, we've all done the little pink pills in our mouth when we were little for the fluoride treatments, right? We know that they've put fluoride in the water system. Thank God you're getting a water filtration system for your kitchen, Courtney, because now you get to take the fluoride and the chlorine that's in our city water. You get that out, right? And on top of it, you are protecting your body by taking iodine. So any exposure that you do get to those halides, and by the way, people, bromide, oh my God, it's in everything. If you get any of your clothes dry cleaned, if you live by a golf course, if you spray your lawn, if you recently bought furniture or a carpet or a rug, all flame retardant material is made with bromide. So we're being constantly exposed. So we have to help our bodies detoxify from that. When iodine is present, it will attach to its receptor site on the cell. That's another receptor site that is on every single cell for iodine. If iodine is present, it will attach and it will do its job. If iodine is not present, those other halides will push out and attach to the cell instead. And then you have a toxic environment. Now you have a shutdown of thyroid function, and then you just have a bombardment of your whole system from toxins that you don't need, very toxic halides that you don't need. So when you look at it that way, and then you look at even going back to World War II, soldiers carried iodine. Why? Because it'll treat wounds, it'll treat viruses, it'll treat bacteria, it'll boost thyroid function, it'll help your energy levels, it helps with fibrocystic breasts, it helps fight cancer, it helps with hair loss. On and on and on and on. You can look at the benefits of iodine. I actually step back and I go, Why are we not all using it? It doesn't even make sense to not use it. Like I said, unless you are in an active, flared up, hyperthyroid state where you are crawling out of your skin, take a break from the iodine. But even for people that have hyperthyroidism, we can use tiny amounts just to support the body because we still want them properly converting T4 to T3. We still want to support their immune system because they have an autoimmune condition that's the other way, that's jacking up their thyroid function. So iodine, honestly, across the board, I think it's a no-brainer. Even if you just do a little baby dose, I think that's important. Oh my God, and brain development. One last thing. Women who are thinking about getting pregnant or are pregnant, you need iodine. If you look at a really quality prenatal vitamin, it has iodine in it. Why? Because that is vital for the baby's brain development. My stepson is nonverbal autistic, very, very deep on the spectrum, very developmentally delayed. And I got to tell you, I look at mom and I guarantee you, she, first of all, she doesn't eat right or anything like that. And I guarantee you, like, I look at her throat and it's swollen. She fluctuates by 20 pounds. Like, I know she wasn't taking iodine, and I bet she has a thyroid problem. And that is so vital to your baby's brain development and reducing the risk of developmental delays.
That's so interesting. So are prenatals, do they have iodine? Because I have 3 kids. I cannot remember, like, if that's in most prenatals or if it's not.
The good ones, high quality ones, kind of the ones that are using folate and not folic acid, right? Those ones.
Exactly. Gosh, it's so funny too. And I have no idea if this is just my personal experience, but I'm just going to ask it because I know you'll probably have a comment or know something about it. When I first started doing iodine, so for those of you listening, you can do like iodine drops, like Lugol's, or I use one from Global Healing, and we can link all this in the show notes so you guys can find it. But it's easy because they're oral drops, so you can dose them really small, and it's easy to take. Like one tiny drop. But here's what I noticed when I first started taking it: like one drop was like almost like intolerable. The taste and like the mouth, like I was just like, oh my gosh, like I don't know that I could do this. Then after probably, I don't know, a week, 2 weeks, all of a sudden I was doing 2 drops and I felt like, I don't know if it was like I got used to it or my body was all of a sudden craving it. Like it was so deficient that it didn't have the ability to utilize it very well. You know how like, if you have a super dry sponge, I see this with some people and it's like, you start giving them nutrients. Well, if you were to pour water on a super dry sponge, what happens? Like the water beads up and it can't utilize it very well. But until you start to saturate it, all of a sudden now it starts to utilize it a little bit better. So that was the only thing I could think of, was like, maybe I was like so deficient in this that I couldn't even almost like tolerate it in a very small dose at first. But once I got in a rhythm and I built up my levels and reserves of that, all of a sudden it was like now I'll do, 2 drops or whatever in the morning. And I'm like, I have no aversion to it. I actually like crave it. Have you ever seen that?
Oh yeah. Oh, definitely. And I even see that with thyroid medication too. When we start giving someone the T3 that they desperately need, their T3 levels might go down after, let's say, a month or so. And that's just their body literally soaking it up. So same thing with iodine. You start off very low and slow and you gradually work your way up. That way you won't feel that icky, jacked up kind of hyper feeling if you start at a high dose right out of the gate. And then for you too, I want to mention, are you putting it in water or are you dropping it right on your tongue?
Oh, I just go straight on the tongue.
Oh my God. Oh, that burns about.
I'm pretty, anybody that knows me, like, I'm just, I'm willing to, I'll just suck
Try
it
it all.
Most people dilute it. Is this what I've been missing this whole time?
I do recommend I do recommend a small amount of dilution. I just put mine literally in like a shot glass of water.
Okay.
So I'll drop my iodine in, I'll fill it up maybe an inch and just slam it down. And if you add a little bit of apple cider vinegar too, just a little hack here, it totally kills that you're drinking a Band-Aid kind of taste. Cause that's what it tastes like. You're drinking like a very strong Band-Aid.
Yeah.
Is the only way I can describe iodine. But you can dilute it too if you don't want to put it on your tongue. Yeah.
I'm so glad we're talking about this because now things are all making sense. I'm like, first thing in the morning and I'm like, getting the peptides ready. And I mean, that stuff will grow hair on your chest. It's like, whoa. Yeah. But that and black seed or black cumin oil, which actually could be a good segue because you just did a recent podcast on this and I've been singing this from the hilltops for the last few weeks. And I think, people are maybe tired of me talking about it, but we're just going to go there now because it's come up. What do you see with black cumin oil, black seed oil in its relation to people that have low thyroid? Where does that fall in the spectrum of hitting processes that are going to help it heal, are going to improve thyroid function? I love black seed oil, so I'll just let you have that one.
Oh, it's amazing. It is absolutely amazing when you start diving into the research. And Dr. Axe has a really good article on his website too. You guys have it where it really breaks down all the benefits of black cumin seed oil. I love referencing that because it's pertinent. It lists it all right there. You dive into the research on this. Oh my God. So when I first studied black cumin seed, yes, I knew that it worked like low-dose naltrexone, that we could give it to someone with elevated antibodies, Hashimoto antibodies, and it would help lower the antibodies. And that it had an anti-inflammatory effect too. So it would take down inflammation in the body. Most people whose thyroids aren't optimized, or if they have Hashimoto's, they're inflamed. There's always kind of some type of inflammation going on. So I knew that benefit, but oh my God. Yeah. Like you said, when you start going down the rabbit hole of all the different things it can do, it becomes another supplement of why aren't we all taking this exactly? So hair growth, improved T4 to T3 conversion, decreased inflammation, decreased pain, reduction of cancer. And I'm like, I mentioned this in the podcast I did on them. If people knew what it actually takes to be able to say that something has an impact on cancer. I mean, unless you have studies backing it, you are getting slapped by the FDA. Like you're taken down, the FTC or whatever 3-letter corporation or governing body is out there to bust you will bust you. You can't say it unless you have backing. But we know now through studies that black cumin seed oil actually helps reduce your risk of cancer. It's crazy. And it's been shown to reduce tumor cells too when given to cancer patients. Really no side effects. So it really is working its way into what I call the no duh supplements. Like no duh, of course you take iodine and vitamin D and magnesium and black cumin seed oil, because why wouldn't you? It has so many benefits with no side effects. So I love it. I'm with you. I absolutely love it.
Yeah, I like the way you call it, the no duh. Those are called, I have recently done some Instagram posts and I call them my non-negotiables. I'm like, there are just a small handful of supplements that the general population, I don't care, male, female, young or old, like these are just going to serve you because you're generally going to be magnesium deficient. We know this to be a fact. I mean, black cumin seed oil is definitely up there. Phosphatidylcholine. I love phospholipid support. I mean, our bodies are under assault from toxins all the time. Like there are just a few things that I'm like, I see benefit for almost everybody. There's very few outliers that maybe don't fit the mold there. So black cumin seed oil, also a very potent supplement. Let me tell you, the first time you take it, you're going to be like, okay, can I commit to this? But again, my personal experience is the more I just start using this stuff, the less offensive it becomes. And now I just do it. I keep a spoon out on my counter next to the seed oil and the PC and I'm just like, here we go. Like this is the lineup. So my eyes watered the first week or two, and now I'm desensitized. It's all good. You always
gotta have a chaser. Like you got to have something that you can eat or drink just to kind of. And I always tell people, listen, most supplements you want to take with food, like black cumin seed oil. That's best taken with something on your stomach already, just to kind of catch it so it doesn't get there and burn. But, some we say, okay, if you can take on an empty stomach, take on an empty stomach. But most supplements we say take with food because it's just better that way.
I know. Yeah. So true. Yeah. You got to chase it with something. All right. So tell our listeners, because I imagine there are people listening that, like myself, have had low thyroid, have been to multiple doctors just like yourself. And they are thinking, okay, maybe I didn't get the right labs run. Maybe I need to take T2, but what is it that's priority number one? Is it getting the lab straight and then figuring out action steps based on that? How do you work with patients where you create action steps? Because I'm all about being able to figure out, what do we do with this information?
Absolutely. Okay. First and foremost, if you are in the category of, I can't lose weight no matter what I do, the weight's coming on, nothing is working, my energy's in the tank, I've done the B12 and I've done this and I've done that, my energy is just garbage, then yes, you can add in T2. It's not going to affect your labs. It doesn't matter if we move down the road and in 4 weeks you get a lab panel done to see what your thyroid's doing. You can start on T2. That is safe across the board. Hypothyroid, not hypothyroid, you just want to lose weight and gain energy. Next up, if all the symptoms that we've talked about, from the hair loss to the brain fog to the constipation, the low energy, if all of those symptoms are ringing true for you, or if you have a thyroid problem and you're on T4 only. And I'm going to side note really quickly, here's a stat for you. Only 2% of the population do well on T4 only. 98% need T4 and T3 together. So if I highly doubt if you're in that 2%, number one, if you feel like a rock star and you're taking T4 only, good for you. Keep going. If you're taking T4 like I was, and you're like, oh my God, I'm suffering. This makes so much sense. I have all those symptoms. Right. Because you're on T4 only. So now let's get some labs done and let's get you treated the right way. And what it's the thyroid is nuanced. Thyroid treatment is very nuanced. There's no one size fits all. It's not like I can say, okay, if this, then this. We have to look at all of your labs together. We have to pair that up with your symptoms. We have to see what else is going on. Are your hormones out of whack? Is your insulin out of whack? But then we start that process. Then it starts, okay, step 1, get the lab. Step 2, let's start on treatment. Let's look at what supplements that you are on. Are you taking too little? Are you taking too many? Do we have to add in like the no-dose supplements? What's your lifestyle? What's your stress? How are you working out? How are you sleeping? And then put all of that into a treatment protocol that you do this and you will get optimized and your symptoms will go away. I mean, sometimes we're peeling an onion with some people, finding out what else is underneath the surface. But for the most part, that's the process. And when you put someone on the right protocol for their thyroid, oh my God, just like me, you get your life back.
Yep. Are there foods that you feel like, well, especially for Hashimoto's, I know you talked about gluten. Are there foods that you are just like, absolutely not? They are just on kind of a list, like knowing that you've had this history with a thyroid condition that you're like, those are off limits?
Soy. Yeah. Soy. And then I would say grains. I mean, yes, you can go gluten-free, but we know that gluten-free isn't grain-free. And we know there's a lot of marketing around the gluten-free products out there and they're still inflammatory. So number one, soy. Soy is goitrogenic, meaning it's going to cause a goiter. It's going to create an estrogen dominant state. And it just really is not good for the thyroid whatsoever. Now, can you use a little bit of soy sauce if you're going out for sushi? Yeah, sure. But I don't want you downing bags of edamame and whipping up some tofu in the skillet. Let's not do that. So soy. And then there's a whole conversation around goitrogenic foods, as in like the raw cruciferous vegetables, cabbage, broccoli, cauliflower. Here's the thing. I don't want you avoiding those vegetables, but I want you cooking them down. So you don't want to be on a raw food diet where you're consuming all these cruciferous vegetables, because they do have a goitrogenic effect on the thyroid. They can interfere with thyroid function and your thyroid medication actually working properly. So we just want to cook them down. Just throw them in a pan with some olive oil, do a nice little stir fry with them, and start breaking down their structure so that you can better digest them and utilize it.
Yeah. I mean, let's be honest. Most people have a really stressed gut as it is. There's no way if you have a stressed gut, you could produce the enzymes necessary to break down raw foods. I just know. I'm like, I don't, and there may be seasons of life that are more relaxed, but the people that I know, in life right now, people have a lot of stress and pressure on them. So just think about your gut. It's just very delicate. And so you just don't want to add extra burden. You can still maybe lose a little nutrient density in the cooking process, but you're not going to take a leaky, dysfunctional gut and then expect it to be able to do something with all of this raw food, because then you end up distended and bloated and your stomach hurts. And that creates a whole cascade of events that's far worse than just taking a little bit less of the nutrients. So that's a really good point. it brings up a question too, when we talk about some of the lifestyle components of the thyroid. What is it that you feel like people have the most control over outside of maybe food that just will optimize their hormones in general? Because there's just a lot of noise in the functional med space or the health space. And it's like, you need this product, you need that product, you need to do this, you need to do that. Like, what is like the 800-pound gorilla that I feel like everybody's maybe overlooking, that you feel like, gosh, this is just undervalued?
Sleep, and sleep. I even undervalued it for a while. So I'm guilty. I'm totally guilty, because I think for me, I didn't sleep well for a large portion of my life, and I didn't want to know the stats of what that was doing to me. So it hasn't been, it was really in the last like 10 years, I would say, that I've gotten more strict with my own sleep, circadian rhythm, the blue light blocking glasses at night, the whole sleep protocol, sleep hygiene to improve my own sleep. And it really does make a difference. And of course, I hear it from my patients too. Like, oh my God, I'm finally sleeping through the night. I feel like $1 million, because it does. It really rejuvenates you. Just that one simple focus, that one simple lifestyle change. Now, I get it. Many of you have issues sleeping. Listen, that could be your thyroid. That could be low progesterone. That could be your hormones being off. That can be liver. That can be blood sugar dysregulation. But we need to figure out the why, and we need to address that, and we need to start doing things to get you sleeping better, getting to bed at the rest and restore time, which is 10 p.m. to 2 a.m. That's when your body really repairs itself and can rejuvenate bodily functions. It can actually help your thyroid work better. Now, I'm not saying you won't need medication. You might, but sleep is vital. I mean, there's a study that has stuck with me for decades now. And it was one where they took a set of twins and they put them in a sleep lab, and they controlled for everything, right? So their DNA is the same, and then they controlled for what they ate, amount of activity, the whole deal. And with the one twin, all they did was stimulate his brain enough to bring him out of REM sleep. They didn't even wake him up. They stimulated him enough to keep him out of REM sleep. And it was within 3 to 5 days that he developed insulin resistance and was actually walking his way into full-blown type 2 diabetes. So we know that lack of sleep, and this all connects back to the thyroid too. We know that lack of sleep can produce insulin resistance. High insulin levels or insulin resistance is a huge inflammatory problem that will push up reverse T3. That amount of inflammation in your body will suppress thyroid function. Now your T4 isn't converting over to T3. So it does have a loop back to the thyroid, but then insulin resistance in and of itself is an issue, increasing your risk of Alzheimer's, Parkinson's, dementia. You're putting on weight. You can't burn fat. You're in a huge inflamed state. It starts affecting your triglycerides. So yeah, sleep seems so simple, but we're not doing it right.
Yeah. I mean, so basically, like what I'm hearing from that too is like, just because you're unconscious, like you're asleep, doesn't actually mean that you're recovering necessarily. So if there are other things, like even having your like Wi-Fi on at night or whatever, like they could actually, even though you are technically asleep, like that could be creating a stress response in your body, because it's trying to mitigate this EMF and frequency exposure to the point that now your body is preferentially dealing with that over doing things like working on your liver, between the hours of 1 and 3 a.m. Which, speaking of the liver, what role does the liver play? Because I think a lot of people are just, our liver, God bless,
our liver.
God bless the liver. But like, what do you see with people that have thyroid conditions in relation to their liver health?
That liver doesn't get enough love. We have to remember that the liver is one of the areas in our body that T4 is converted to T3. So we convert T4 to T3 in our thyroid gland, peripheral tissues, gut, liver. And if we're not taking care of our liver, it affects so many metabolic processes. So yes, insulin resistance, that's one of them. Just inflammation, detoxification. Everything gets processed through the liver. And it doesn't take an elevated marker on your labs for you to have a sluggish, clogged liver. This happens long before we start to see that ALT, AST rise. And it can happen as simple if you're taking Tylenol, if you're drinking alcohol. But here's the other thing. Those are the big ones. But people will ask me all the time, well, what am I doing, to bombard my liver? You're living. The air you breathe, the water you drink, the food that you eat. I mean, unless you're in a bubble, you're getting exposed to things that have to get processed through the liver, the lotion you put on your body. And yes, even the good supplements and medications and hormones that you're taking that are going to give you life, they still have to be processed through the liver. So we have to make sure that that is functioning properly. And it doesn't take a big, huge liver detox, anything. You just want to support the liver. So yeah, pulling out alcohol, fantastic idea. Using turmeric instead of Tylenol, excellent idea. Getting a water filtration system, getting just different things that changing out your body wash and your body lotion, little things like that you can do, because some of that you can control, and then some of it you can't. You can't control everything, the air that you breathe when you walk outside, or everything that goes into your mouth when you are traveling or going out to eat. I get that. And I want you to still live, but then let's support your liver at the same time.
Yeah, that's really good to know. I think about the liver as something that's just like daily. Like I'm constantly doing herbs that support liver detoxification, milk thistle, globe artichoke. There are great herbs that help tonify the liver. B vitamins are really important. And acetylcysteine is great. And you don't need to hammer these home all the time, but I'm always finding ways to deliver some form of these nutrients that are specific to phase 1 and phase 2 detoxification. And then honestly, just make sure you're pooping at least once or twice a day. Yep. I mean, that's a big sign right there. If you're constipated, you're toxic. You've got a backup in the system that you have to address. And sometimes, you may need to even bring in a water enema or a coffee enema or something like that. Magnesium can be super helpful, but those are all signs. We've talked about that in a lot of podcasts, but what's really interesting to me is how all of it comes full circle. We're talking about the thyroid, but we can't talk about the thyroid without talking about the liver and without talking about your sleep patterns and your circadian rhythm and all these other things. Just like many of our conversations, if you don't address the big pieces of your lifestyle puzzle, it's going to be really hard pressed to find somebody that can just tweak one thing about one tissue and gland and say, nope, you're good to go. You have to, they're all influences of how all the different organ systems express themselves. And so you have to collectively put forth some effort in those areas to get the result that you want. So this is so fascinating. I'm geeking out because, like I said, you are a phenomenal communicator and educator, and you've got so many resources on your podcast, which is the Thyroid Fixer podcast. So guys, you have to make sure that you check her out. Her resources are phenomenal. Give us some ideas of where people can connect with you and some of your communities, because I know you have a membership as well. You even mentioned that they do lab reviews, you guys do collective lab reviews, things like that, because many people like to take their health back into their own hands. That's why they're listening to this podcast. And so I want to be able to give them, if there's somebody dealing specifically with a thyroid condition, where they can connect with you to get their hands on these resources.
Yeah, absolutely. So you can go to my website at dramieHornaman.com. And if you're interested in jumping right in to fixing your thyroid, addressing your hormones, working together, you can book a call. We're going to go over everything that you've done, what you've tried, all the doctors that you've seen, because I get it. I've been there. And we're going to really figure out, okay, here's the program that is right for you. And we can prescribe to all 50 states. We can do bioidentical hormones. We do thyroid. We do the whole thing. So we got you. But if you're not quite ready to make that step, I built the Better Thyroid and Hormone Club because this is a place where we can all come together. And maybe you're not quite sure, I think I have a thyroid problem. I'm not sure. I was told that I was normal though. We do live lab reads. I bring in guest experts to do live Q&As with you. And then, of course, you get the bonus of being able to post and ask me questions directly. We have weekly experts come in, but the live lab readings are probably the most popular because then that way we're going through your labs, live. I have your labs up on the screen. I'm asking you questions. I'm going, okay, your free T3 is low. That reverse T3 is high. What do you want again? Oh, you're not on anything. Okay, well, we're seeing some thyroid antibodies, and some hormones are low. Here's exactly what you have to do. And I will give you exactly what you have to do. Now, whether your doctor implements that or not, we don't know, but that's okay. We gotcha. I'm here if they don't, but it's at least giving you immediate feedback, maybe before you jump into a big program, to know where are you in your health. And then it's just a fantastic community. So that's at betterhormonesbetterlife.com.
Okay, that's incredible. I find tremendous value in memberships. I'm a part of several because I find that getting communities that are all very interested in furthering their education, it's like you immediately have a sounding board of like resources you could go to with a lot of voices that have experience in one specific area. And that's what I want to know. I want to be able to look up, one thing and then be able to get 15 people's take and experience on it. I'm like, okay, so maybe this is what I could expect, or this is a potential. So we have so many experts and they have these great memberships. We actually have Jay Campbell. I just interviewed him, which I know you know.
I know.
And so anyway, and he has a great peptide community too.
I'm part of it. I know. I'm part of that community.
It's a great place. But again, just all that to say that there are a lot of resources available to you guys. And truthfully, like you have to prioritize your health. Like to me, even being in this space, like I find value because I need to be able to learn from the community and groups of experts that have really dedicated their life's work to that field, because it's like finding a needle in a haystack. Good luck going on Google trying to find answers. Right. I mean, you'll just pull your hair out, but you can really access a lot of these things, these tools, and really people that are very experienced by being a part of a community. So we'll make sure that we link all of that. And we'll link about your T2 product, Thyroid Fixer, but you've got a full supplement line, the Fixxr line. Your podcast is a phenomenal resource. Definitely follow, subscribe to her channel. She is one of the few that I actually subscribe and listen. So, and I told her that before. And it's true. So I could vouch for the content that she puts out is super, super helpful. But Dr. Amie, I'm just so glad that you came on. We're going to put the other things, the iodine. There were so many like little nuggets, guys. So go to the show notes. They'll be packed with all the details of some of the things that we covered in today's show. And thank you for being here. This has been so fun.
Oh, it's been tons of fun. Thank you so much for having me.
It's if you're not watching on YouTube, it's like the Blonde Squad, because we're both blondes. My setup right now is not my usual, but I got kicked out with all the other things going on in my house of my office. But we had a lot of fun. The blondes had fun today.
Yes, they did. Thank you so much.
All right, guys. Well, if you love this show, share it with a friend. Let us know. Hit me up on Instagram. You can follow the Health Institute, follow Dr. Amie Hornaman and all of her work. We'll see you guys on the next episode.